Hello, I'm going to share you some clinical insight about a deep-acting polycrase drug, ANTIMONIUM. ANTIMONIUM is mainly of hydrogenate constitution and of psychotic in origin. The ANTIMONIUM patients are highly irritable. They are irritable like ANTIMONIUM, Senna, Chamomilla, Senicula. But the difference is, with that irritability, there must be extreme drowsiness and extreme weakness that differentiate ANTIMONIUM from other drugs. Through the entire drug, the weakness is pervading. The weakness is especially in the lungs. The lungs or the bronchial tubes are loaded with a lot of mucus. There is a lot of rattling in the chest, but the patient is unable to expectorate it. The lungs do not have the power to expectorate it. This kind of scenario is usually seen in bronchial asthma and bronchopneumonia cases. You may have seen that whenever a patient is admitted in ICU for pneumonia, doctors and physiotherapists often perform percussion on the chest like this. This is usually done for loosening the mucus so that the patient is able to expectorate it. In this kind of scenario, ANTIMONIUM is usually indicated. In Allen's, it is written that whenever in pneumonia, the right lung is affected, with that you see jaundice, then do definitely think of two remedies. One is selenium, another is ANTIMONIUM. The ANTIMONIUM cough is aggravated from damp basement, from dampness. So it is aggravated in spring and autumn season because these are the season of dampness. And this drug is of hydrogenate constitution, so it is obvious that this season will aggravate the ANTIMONIUM patients. Another important thing is the vomiting of ANTIMONIUM. The vomiting may be of gastric origin, or it may be due to cough, which is mainly of pneumogastric origin. But the important thing is the modalities of ANTIMONIUM. The vomiting is only ameliorated while lying on the right side, and every other position, the vomiting is aggravated. In Allen's keynote, it is also written that it is also a very good remedy for the bad effects of vaccination whenever Tuja is failing and silesia seems not indicated. Another important rubric about ANTIMONIUM is cough with twitching of the facial muscle. This is only seen in ANTIMONIUM. Dr. Grimmer says an important thing about ANTIMONIUM. Whenever you find an ANTIMONIUM patient and you are giving ANTIMONIUM to that patient, but the drug is acting very slow and you are not getting desired result, then a dose of sulfur will arouse its action. And Dr. Allen says a different thing. Whenever ANTIMONIUM fails to clear a case, in such scenario, Heparsol is usually indicated. Dr. Herring also used this remedy for warts on the dorsum of penis, and Dr. Clark used this remedy for gonorrheal ophthalmia in previous time when gonorrhea was prevalent. In cases of fever, if it is a case of ANTIMONIUM, you will find that the patient are usually thirstless. So this is more or less about ANTIMONIUM. I hope you enjoyed it. Thank you.